Hello again, my name is Ernest Minu. Let's settle for the details now. The National Public Health and Reference Laboratory in Accra will now be able to conduct sequencing of SARS-CoV-2, the virus which causes COVID-19. Sequencing has helped to identify new variants or strains of the infection and help medical experts to amend the management of the disease as appropriate. Until now, only the Noguchi Memorial Institute for Medical Research, the West Africa Center for Cell Biology of Infectious Pathogens at the University of Ghana, and the Kwame Nkrumah University of Science and Technology had the capacity to conduct genome sequencing of the various virus to establish its changing characteristics to help in the effective management of the disease. We'll get a better education on the genome sequencing shortly and how this is important. But first, listen to the Director General of the Ghana Health Service, Dr. Patrick Kumar-Boaji, when he took delivery of the equipment for the National Public Health and Reference Laboratory.
At the beginning of the pandemic, as a service, our drive was to ensure that we don't just fight the virus now, but also prepare for the next one. And so as part of our response, we ensure that we both will be better off now. And I can say that our response, our preparation is much better today than in March last year when we saw our first case. And this has not happened this has happened with strong support from CDC and other partners. CDC has helped us establish our national EOC, helped us establish regional EOCs, and then we've also expanded our laboratories. When we started, we had only 2 labs, academic labs. Our objective to ensure that by the time we finish with the response, we are also ready as a public service, be able to all the time be able to work well to identify emerging diseases, get this, the serotypes that we are getting so that we can respond better. We've been doing this with meningitis, but this has helped us now. So with the support with the molecular labs and the EOCs, we are now going to do sequencing. And so we are able to always be on top of whatever we do. And then we can also tailor our messages, our responses into the need of the current system. So I want to use this opportunity to thank you for this important support that really goes to improve our capacity to respond. This support also helped us give the regional capacity has expanded so that they do not have to wait for the national level instruction, but they are able to tape up responses and also act as quickly as they need be.
We can now hear from the head of the National Public Health and Reference Laboratory, Dr. Gifty Boatin, who spoke at this event.
These are equipment for sequencing. It's a main ion equipment for sequencing, and it is not just the equipment. It came with its reagents for us to be able to do the sequencing, and also it came with consumables. And when we talk about consumables, all the things that when you are testing, you use and then you don't get them back are also added to these donations. And with this, we'll be able to start doing sequencing for Ghana Health Service, which has already been started by other labs. So we also join to get the other variants of COVID-19. You know, currently for where we are, the variant keeps on changing. And so this is very, very important at this stage of our fight for COVID, because we need to know the different types of the variant that keeps on changing so that we're able to get the appropriate response for that.
So we can now talk about the new variants, and new variants have made the fight difficult for epidemiologists because the virus changes in character just when a solution is being worked out. This week, a new strain said to be deadlier than the dreaded Delta has been discovered in South Africa and already found its way into other countries. We'll come to that shortly, but take a look now at the different variants of SARS-CoV-2 experienced since the outbreak of the disease, and the World Health Organization has classified them into 3. So you have variants of concern, that's the first classification. So you have Alpha, which was first found in the UK, Beta, South Africa, Gamma in Brazil, and then the Delta variant, which we know is very vicious, that was found in India. The other classification is variants of interest, and there are 5 of them. So you have Eta, you have Lota, Eta multiple countries, Lota in the USA, we have Kappa in India again, and then Lambda in Peru, and you have Mu also in Colombia. So that's the second one. Now there's a third one, and these are variants still undergoing classification. And so we have what we now know as the C12, which has now been found in South Africa. And we are learning that it is more dangerous or vicious than the Delta variant. Now, the WHO Director for Africa region, Dr. Mashidi Sumweti, has been speaking at a news conference today about Africa's COVID-19 situation. She revealed that the third wave is claiming more lives. Now, at least 26 deaths are recorded every hour on the continent.
24 out of 54 African countries, so nearly half, are still reporting high or fast rising case numbers. The epicenter is a moving target, shifting from one sub-region to the next. Cases are rising in West, Central, and East Africa. In this third wave, every hour, 26 Africans die of COVID-19. The pandemic is still raging, and we must not let our guard down. As long as vaccination rates are low, severe illness and deaths risk staying high. Over 143 million vaccine doses have been received in Africa, and 39 million people, less than 3% of Africa's population, are fully vaccinated. That compares to more than 50% in the European Union and the United States. Equally concerning is a continuing inequity in the distribution of doses. Africa accounts for just 2% over the 5 billion of the over 5 billion doses given globally. This percentage, I'm afraid, hasn't shifted in months. It is encouraging, though, that in the past month, almost 21 million doses have arrived on the continent through COVAX. That's equal to the entire 4 previous months. As WHO, we're working tirelessly to support countries to hit the global target of fully vaccinating 10% of their populations by the end of September. We've just 1 month to go, and this must concentrate our minds in Africa and minds globally.
Still with the WHO, it says that African countries must also zero in and drive forward precise plans to rapidly vaccinate the millions of vulnerable people that are still faced with a grave threat of COVID-19.
Already, 9 African countries have reached this target, so that's very encouraging. Among those are the island nations such as Seychelles and Cabo Verde, countries that have rolled out vaccines strongly from the start, such as Morocco, and countries where the uptake is rapidly increasing, like South Africa. Many of these countries are in the upper middle or high income brackets and have procured vaccines directly from manufacturers as well as receiving various vaccine supplies. For lower income countries that are relying mainly on donations, the situation is more dire. If the current trends hold, 42 of Africa's 54 countries, nearly 80%, are set to miss the September target, I'm afraid. 3 more countries, Equatorial Guinea, Comoros, and Sao Tome and Principe, will meet the target at the current pace. I think a couple of other countries as well, like Senegal, Namibia, and Botswana, if these speed up vaccinations, they too could still reach it. I do commend the commitment of national and local authorities, communities, and partners who are working hard to expand the rollout of COVID-19 vaccines